Welcome. I'm Senator Josh Becker, and I want to thank you for joining us here today at my very first town hall since being sworn in to represent you all, the residents of Senate District 13. It's an honor of my life to be elected to the California State Legislature to represent the peninsula. It's a very large district, as you may know, from South San Francisco all the way down to Sunnyvale, from the Bay to the ocean. And I'm excited to put my background to work as a public interest entrepreneur, my background as a national environmental leader, and as a public policy innovator to serve all the people in this district. I love the quote from Ellen Johnson Sirleaf. She was the first woman elected leader in Africa, who said, if your dreams don't scare you, you're not dreaming big enough. So I look forward to working to make our shared dreams for California a reality. My wife, John, and I are raising our two teenagers. And so I'd like to say I appreciate any thoughts, advice, or prayers that you have for me on that front. And I'll refer to them later as they are living this pandemic, learning remotely, as many of your kids are as well. To use an overused phrase, we are truly living in unprecedented times. COVID has made us live in a world where we have to be 6 feet apart from everyone other than our immediate household. We're isolated from each other, we're cut off, but we've still seen tremendous acts of community where neighbors are helping neighbors, institutions stepping up. That's been very inspiring to me. But yesterday, January 20th, where our nation celebrated a return to experienced leadership and common sense, was also the one-year anniversary of the first case of the virus diagnosed in the US. And in that time, in 1 year, as you know, we've lost over 400,000 Americans to this disease. Millions of Americans are without employment, housing, or health care. And like you, I've been angry and frustrated. So much has changed, so much has been torn asunder in that year. And like you, I worry about keeping my family safe, and I'm frustrated that my high school freshman has not seen the inside of a classroom, that my high school junior is still remote. I'm frustrated he can't get can't get on the field or use shared equipment. And that's why these issues are so important, and I feel all these things so personally with all of you. We're fortunate to have two amazing guests with us here today. I want to welcome Dr. Anand Chabra from San Mateo County and Dr. Mark Adams from El Camino Health. I really appreciate you both being here. Thank you very much for joining me here today. We're going to talk about a lot of issues here today about the virus itself, and certainly about the vaccine rollout. I know that's very much on the minds of people that I hear from, and I know for both of you that you hear from as well. And I've been frustrated by the slow pace of the rollout. The vaccine is really our shining hope after a difficult year, and we have to make the rollout fast and efficient. As I believe it focused on is how's the vaccine administered, who administers it, data transparency, a supply, and the sign-up process itself. And where we have seen an absence of leadership at the federal level, we have seen local government step up. And that's why I'm very happy to have Dr. Chabra here today. I also spoke at length to the leaders of Santa Clara today as well. And we have Dr. Adams representing El Camino here with us. I do think it's important to understand the overall flow of vaccine, and we will get into that later on as we go. But it has been great to see the counties step up. Santa Clara at the fairgrounds, Santa Clara Health System's doing about 6,000 vaccines a day. They're opening a center in Mountain View tomorrow that will gradually ramp up to 500 or 1,000 people a day sometime soon. San Mateo has started mass vaccinations at the event center. So there is tremendous work that is being done at the local level, as we will discuss. So let me first now introduce my panelists and First, Dr. Chabra, thank you for being here. Dr. Chabra has been a physician with San Mateo County Health for 21 years and the medical director of the Family Health Services Division since 2015. Prior to joining San Mateo County, he served as a medical epidemiologist and public health physician with the California Department of Health Services. He completed his undergraduate work at Stanford University and his medical degree at the University of Washington School of Medicine, as well as a master's of public health at Berkeley. He's trained in pediatrics and public health and general preventative medicine at UCSF and at Berkeley. In addition to his current duties, he's also an assistant clinical professor of epidemiology and biostatistics at the UCSF School of Medicine. An incredible background. At this time, I would like to welcome Dr. Chabra, and I'd like to invite you to make some introductory remarks.
Thank you so much, Senator Becker. I'm very pleased to be here today, and it's great to have this forum to share some information. My role right now is really all around vaccine and, getting COVID vaccine out to the community. So for the last number of months, I've been the section chief of COVID-19 mass vaccination for San Mateo County Health, and I've got a great team of people working with me around that. I know we'll get into more details as we talk about the questions, but I just want to give a little bit of a framework of how the local health department role in vaccine rollout. So there are relationships for the long-term care facilities where the federal government directly provides vaccine to two pharmacy entities working in California, CVS and Walgreens, and it's their role to directly vaccinate staff and residents at long-term care facilities. So that's skilled nursing facilities, assisted living, other residential facilities for the elderly or the disabled. The second big route of vaccination is through what we call multi-county entities, but these are basically the large health systems, so Kaiser, Sutter, Dignity, etc. And these vary depending on which county you're in. For San Mateo County, it's really those three plus AHMC, which runs Seton and Seton-Cosi. And those entities receive vaccine directly from the state health department. So that is a relationship between the state health department and those entities. And we're not really in the middle of that. Initially, we supported them with the first round of vaccine, but after that, it's really been a direct relationship between the state and those entities directly, with us more being off to the side. And then obviously there's the county specific role, which is really around coordination for other providers to do some vaccinating ourselves, as you mentioned, the event center last week. And then also to ensure vaccination of the most marginalized populations. So those who are part of our San Mateo Medical Center system, which is the county hospital and clinic system, and also those who are indigent and don't have a source of health care, maybe homeless, maybe farm workers, so other populations where they don't necessarily get reached by the big healthcare systems. So that's sort of a bit of the environment of how this goes, the process goes. We really, at least in San Mateo, we're very much following the state guidance on how to roll out vaccine. And I know there is variation from county to county, but we've really tried to tie ourselves very closely with what the state guidance is around vaccine rollout. And, I look forward to the discussion. Definitely know that people are wanting vaccination to happen faster than it is. And I think we all want that. I have both of my children at home, 21 and 19, attending college from home, my wife working from home. And so everyone wants this to end so we can get back to semblance of normality. So looking forward to the discussion. Thank you.
Well, great. Thank you very much for that overview. It's really important because a lot of people are trying to understand where do they go for vaccines. So it's really important to understand the way the state designed it to understand those flows. And speaking of work from home, they're demolishing the fire station across from my house. So you hear jackhammering in the background. We're all dealing with work from home situations. So that's one of my situations. Again, yeah, thank you very much, Dr. Sharma, for that introduction. Initial remarks. Now I'd like to introduce Dr. Adams. Dr. Adams is the Chief Medical Officer for El Camino Health and previous interim system Chief Clinical Officer for SSM Health. Based on many years of diverse experience in healthcare, Dr. Adams brings a unique perspective on healthcare, which has been developed with a broad understanding of constituencies, including purchasers, payers, providers, hospitals, consumers, and government. He was interim Chief Medical Officer for SSM Health, which is a faith-based health system with annual revenue of $6 to $7 billion, including 20 hospitals in 4 states, large medical group, health plan, pharmacy, etc. He's a board certified vascular and thoracic surgeon, and he currently serves on the board of directors of Cambia Health Solutions based in Portland, and which provides health insurance for many states. He has his MD and undergraduate degrees from the University of Pennsylvania, and he was rated in the 100 CMOs to know in 2017, and has many honors, Best Doctors in America, America's Top Surgeon, and many, many more. So Dr. Adams, thank you for joining us here today. Would you like to make some introductory remarks?
Yeah, sure, and thank you for that introduction, Senator. Appreciate that, and welcome to everyone out in the virtual audience. I just wanted to quickly, as the CMO, I'm actually all of the doctors' boss, although most doctors don't believe they have a boss, but actually I am their boss. But of course, that takes some diplomacy to deal with that. But I wanted to quickly recap sort of where we are with the disease, just so we're all on the same page. You know, there's this coronavirus. It's a common virus. It's actually the common cold is caused by a coronavirus, but this one is different because it's more infective and it has some more serious effects on some people. It's an upper respiratory tract infection, again, similar to a cold or the flu. But currently, you know, we really have had an explosion of infectivity and spread. And the reason for that, and this is really important for everyone to understand, that there is a period of about 2 days between the time that you get infected and you can produce virus and infect others and the time you get sick. And so those couple days where you feel fine, you're actually spreading the virus. And what we found is, as we're testing a lot more people, thousands and thousands of people we've tested, the asymptomatic people that feel fine, that the number of those that have been turning positive has been going up. And so that tells you there's a lot more people who are not sick, but can spread the virus in our community. And that's really what has fueled this rapid increase in California, and of course our counties that we're talking about as well. The other thing is that, you know, most people actually recover okay. You know, not a lot of people on a percentage basis die from COVID, but unfortunately, so many people are infected, even a low percent results in a lot of deaths. And that's really the sad part of all of this. We've learned a lot about taking care of these patients. More patients that we test in our emergency department positive go home than come in the hospital. A lot of people can go home and recover okay. The people that do come in the hospital, they're the sicker ones. You know, we have learned a lot about how to treat them, and we've really been very successful with that. We keep them off the ventilator. You know, we do some different maneuvers with them that really seem to get them to a point where they can go home again. We're going to talk some more about the vaccination. I did want to mention we do have monoclonal antibody therapy. That's a therapy that helps to reduce the effects of the COVID virus, and it's designed for people that are not sick enough to come in the hospital, because those people already are past the point. But for people that can stay at home, the monoclonal antibody can reduce the effects of the disease. So it is a benefit. We do have a supply of that, and we certainly can, you know, are happy to make that available. I will say, you know, Senator Becker mentioned common sense, and I would say that that's really important here because, first of all, common sense is like deodorant. People that need it the most are often the ones who use it the least. But I will say, I'll tell you, so what's going to happen in the future? And I would say I've seen this is one of the best common sense approaches I've seen yet. It does happen to be from an infectious disease expert at the University of Pennsylvania, but that's just by coincidence. There's so much misinformation. So step one, stop listening to all the news and reports and all the stuff on the internet. We all should just sort of stop doing that because there's a lot of misinformation. So here's what we need to do to get through this. We should immediately be more aggressive about mask wearing and social distancing because of the new virus variants. You know, in California, we have a new variant that's more effective, right? It's this L452R. It's not the UK one, that's a different one. So we've got to do that. We should vaccinate people as quickly as possible. And that means get the vaccines out as fast as we can. People who have received their vaccine shots, this is really important. And if they have waited long enough for them to take effect, which generally is about 10 days after the second shot, they can do things that unvaccinated people cannot, like having meals together, hugging their grandchildren. Okay, so that's a benefit. But until the whole pandemic is stopped, all Americans need to keep wearing their masks in public, help unvaccinated people stay safe, and contribute to the shared national project of saving every possible life. We have to, no matter what, we have to stop the spread, because as long as it keeps spreading, it will keep mutating and these new strains will keep popping up. So we can do this, it's within our reach. I think it's going to happen in the next couple of months, and hopefully by summer, you know, we'll sort of see the light of day. But these are the basic common sense things if we all did that tomorrow, we would get through this.
Well, thank you. Thank you for those words. And I appreciate that attitude. And I think it's one that we all need to adopt. And you and I discussed this earlier, and let's start on health. Well, it's just for a few kind of ground rules. Again, when we scheduled this weeks ago, we really were focused most exclusively on health, but now we have got so many questions on vaccines. Of course, we're going to focus a lot of time on vaccines. The questions were requested in the advanced via email when you RSVP'd, and we received hundreds of questions. So we will work hard to get to those. Oops. You see me? Oh, sorry. Sorry, I had a little equipment malfunction there for a second. So we will work hard to get to those questions. But unfortunately, we can't answer every question, although both panels have agreed to stay longer, because we realize by 6 o'clock, we're definitely not going to get to all questions. So we will run over a bit to try to answer more questions. If you would like to ask a question via email during this discussion, you can send it to senator.becker@senate.ca.gov, senator.becker@senate.ca.gov. We'll be monitoring the inbox for additional questions as we go. So anyway, with that housekeeping note, let's then get going. But Dr. Adams, again, just to start on health, you mentioned the variant. Just so people understand, you're saying the variant is, well, just maybe you comment on its, what is really different about it? Is it merely just the increased sort of transmission risk? And how is the vaccine holding up to the variant in either of your minds?
Yeah, it seems to be, it's more infectious. It does not seem to be more lethal, but it does seem to be more infectious, so it spreads more rapidly. And because of that, it's rapidly taking over as the percent of all the virus out there is growing, because it's more infectious. It's competitively better than the other strains. But it does appear so far that the vaccine is effective against it. And I think that's just something we have to keep checking, but it does appear that it is so far.
Great. Dr. Chabra, any other comments on variants or the state of the virus itself?
Just agreement that the limited information we have seems to suggest that the vaccines are effective against it, but it's early days.
Yeah, I understand it's early days. But Dr. Adams, to your point, it really mutates when it spreads, right? So all the more reason to double down on masks and distancing and other things to stop the spread, because it only mutates, of course, when it does spread. So we appreciate that sentiment. You were referencing, we were talking earlier, sort of a New York Times article that sort of talked about kind of some communication messaging around this. Anything, last comments on that?
Yeah, and I think, and I try to capture some of that from this Dr. Richterman at the University of Pennsylvania, but we've done a mistake by emphasizing the sort of exceptions, or by saying the vaccine's 95% effective. Well, it's extremely effective. I mean, that's like 100%. And even the people where you catch the COVID, you don't get sick. So to me, that is great. That's 100% effective, and people should be clamoring to get vaccinated. The complications and the side effects, most of the side effects are minor. There's rare allergic reactions. We've done thousands of vaccinations already here at El Camino. We've had no adverse reactions that required any specific treatment, other than maybe take a Benadryl. And so it's really, we need to emphasize how important it is to get vaccinated. It's safe, it's effective, it works, and it will help us get rid of this.
Yeah, if I could, I would want to highlight the same things that Dr. Adams did, that, we just vaccinated 9,550 people in 7 days at the event center. And, some people had mild reactions, as you say, maybe they needed a Benadryl or two, but really no severe reactions in that setting. And even the issue with the one lot of Moderna vaccine, which came up over the last few days, that was thoroughly investigated. It was, in one location, in one county, and at this point, everyone's very comfortable that there is no systemic issue with that. It was something about that particular site, but the vaccine's safe, and people can use that lot of vaccine again. So that's really good news.
Well, that is great news. Well, I appreciate that. We had gotten a lot of questions about the variants, and so I appreciate being able to sort of address it off at the top. So, Dr. Adams, you talked about people clamoring for the vaccine. So we do have people, fortunately, we do have people clamoring for the vaccine. And I wanted to get into that. As I mentioned, some of the areas I've been focused on really, how it's administered, who's administering it, the data transparency, supply, and a sign up. And there's been, I think part of the frustration, that we hear is sort of the feeling that California's vaccination rates are lower compared to other states. Can you tell us, what's been the biggest hindrance in distributing the vaccine? Is it availability of the vaccine? Is it medical staff to administer? Is it the way it was sort of, the sort of tiered system? In your minds, what's sort of the hindrance in terms of getting it out there?
Well, yeah, sure. And Dr. Schwaber, probably knows more about it than I do, but at least for where we are, Santa Clara County, it's a distribution challenge. We want to get as much vaccine in people's arms as we can. And we certainly have ramped up the ability to do that. We have a lot of retired nurses who have volunteered. So we don't really have a problem with people to provide the vaccine. We have space, we have a method to do it. One thing we've had to schedule people because the dose, we never know how many doses we're going to have that far ahead. So sometimes we don't even know we're getting a shipment until the day before. Santa Clara County tells us sometimes a week ahead of time, they know they're getting it. So we have to carefully match the people that we want to vaccinate to the doses that we have, because we never want to waste any, and we have not wasted any doses. But to do that, we do have to schedule people and do it in an organized fashion. We now have a website. People can go on it. They can schedule their own vaccine. We're working down the tiers. We are allowed to progress down the tiers as long as we have a supply and we're meeting the demand from the previous tier, which we believe we are. So yeah, those are some of the logistics. I think if we can get more steady supply, we will happily vaccinate more people.
Dr. Chabra?
Yes, thank you. I do agree with Dr. Adams. Those have been some of the major challenges. Initially, when the state provided guidance around phase 1A, they talked about a tiered structure. And so, we were trying fairly, consistently to stick to those tiers. And I think that slowed the process down. A few weeks ago, they said, okay, forget about the tiers, just vaccinate everyone in phase 1A, which is healthcare workers and the long-term care residents and staff. So that, I think, moved things along, and that really helped. But the fact that our supply is unpredictable is very, very challenging. We've had, at least in San Mateo County, we've had 1 week where we had 100 new doses of vaccine, and other weeks where we've had, 9, 10,000 new doses. And having that kind of range makes it really, really hard to plan. I know the state wants to make it more predictable, as do the feds, but it hasn't happened yet. And so it does make the actual vaccination clinic setup much more complicated if you don't know what to expect. And we certainly do not want to waste doses. And so given that the vaccines are not the easiest vaccines to work with, Pfizer needing the ultra low temperature freezers, Moderna needing regular freezers, but neither of them can be out at room temperature for very long. So you have to really, plan very carefully who's going to be available to be vaccinated, and, have wait lists in place and all those pieces that are just logistical challenges. They're surmountable, but they are challenges and have, I think, slowed the rollout.
Good. We both touched on many things that we've gotten questions on that we want to follow up on. Just since you mentioned waste, I think that's, any notion, just like the rumors or feelings that there's waste, just gets people I think, most people feel that there's an efficient process. They're willing to wait their turn, but that's sort of one of the things that you hear. So can you address that? My understanding is there's actually been very little waste at the county level.
Correct.
And Dr. Adams, you referred to that. So Dr. Chabra, can you comment on any comment?
Sure, yeah. So our experience in San Mateo County is very, very minimal waste. I would say in the order of 2 or 3 per 1,000 doses. And, we don't even want that. Sometimes, mistakes do happen. But that said, it is a huge priority not to allow any doses to go to waste. Certainly, nothing has expired because, as long as they're in the freezer, they have 6 months that they can last in there. So no doses are expiring that are actually in a frozen state. But sometimes once you've thawed a vial of vaccine, you just may not be able to get that last person. And the vials actually also give varying amounts of doses. So while the Moderna vial is a 10-dose vial, you can sometimes get 11 doses out of it. And the Pfizer vial is a 5-dose vial, but sometimes you get 6 or even 7 doses out of it. So that also adds another layer of unpredictability. And it's good news to get more doses, of course, but it's not 100% predictable how many you'll get.
Yeah. Dr. Adams, your experience is similar, very little, you would say?
Yeah, totally agree. We have really been extremely careful about waste. We really are not wasting doses, and that's really important. And so we want to get every dose in someone's arm that we possibly can.
And Dr. Adams, you have a wait list coming soon that you mentioned?
We do. We're working on that. It should be up, in the next day or two. We initially had to slow down because of the Moderna recall potential, but now that's been released, and so we're now going back full steam ahead. And we are setting up a way of having people that could be on call in case there are some extra doses or no shows. Sometimes people schedule in more than one place. They've scheduled here, they schedule there, and then they don't bother to cancel, if they go somewhere else. So we also want to be prepared to fill those people in as well.
Yeah, that's what I'm saying, right? I was saying, we were talking earlier, was to say there must be some people just don't show up, right? So you want to have that wait list, but right now you have 6 hours, right? So it's before, before you can't use it. So you've been able to fill it, but I think the wait list will be helpful there, which is.
Yeah, and one thing, Senator, that I thought it might be worth, for your audience is, it not only is it very safe, but what I've learned talking to people that have been resisting getting the vaccine, we have spent time meeting with some groups, particularly employee groups. And so sometimes you don't know what you don't know. So some people think that it somehow changes your DNA. It doesn't touch your DNA. The mRNA goes into your cell and it never goes into the nucleus. That's where the DNA lives. It never touches it. And that mRNA disappears very rapidly. It doesn't hang around. So no one will be turned into a frog or to another, the DNA will not change. And I think that's really, important for people to know. And then the other thing, some people think you're going to spread the virus by getting the vaccine. There's no virus in the vaccine, there's no viral components of that. And so that's another, I think, misperception that people have. So none of that, is going to happen. And if anything, we found that some people said, well, our families didn't want us to get it. They're afraid of what will happen if we get it. It protects your family. It's a benefit to your family. And so really, if you have a chance to get it, get it.
Yeah. Well, I thank you for, going over all those points. Many people here today are people who want the vaccine, but there are many people in our community who are less sure. And we do need to get those messages out because I was talking to one, health center and, getting even some of the nurses and the staff were reluctant. And so we do need to keep reinforcing these messages. So I do appreciate that. Speaking of the question of who can administer, I have gotten a number of emails just personally, as well as, from here today and the questions from people who are interested in volunteering. These are mostly retired MDs and others. I know, Dr. Adams, I know you have a lot of retired nurses who have volunteered already during this time.
Yes, we have many people, really even many more than we need at the moment, but we certainly are keeping them all sort of close to the vest. So as we do expand, so we can do more mass vaccinations, we have them ready to go. So yeah, that's really important, obviously, that we have people to be able to do it. But lots of people are really interested in doing it. A lot of community support for that.
Yeah, well, that's great. It's one of the things I mentioned earlier, right? Just to see people step up in so many ways, bringing food to their neighbors, bringing medicines, or in this case, stepping up. And again, I personally get emails from people saying, hey, I want to volunteer. I have a relative or, who wants to volunteer. Where do they go? So Dr. Schomburg, maybe can you tell us for San Mateo County, is there a process now and where can people go if they want to volunteer?
Thank you. So we do have a newly established process for that. And so I provided you with the information that you can share with your constituents about that. And, it will be organized through our Emergency Operations Center. And there's a website that folks can go to and sign up. And this would be around clinical folks. So this is specifically for, doctors and nurses, pharmacists, dentists, anyone who is allowed to administer vaccines. And those categories have been opened up a little bit at the state level to allow additional people, as well as some students in health profession schools, to participate. So I think there's a large group of people who could potentially assist in that way, and we encourage them to sign up through the link that I provided you.
Great. So we will be sending out that link as part of our follow-up. Also, if you'd like it again specifically, just email the senator.becker at senate.ca.gov, my email address there, and I will make sure that you get that. So let's move to the, how we're administering the vaccine. You both have made references to mass vaccination centers, and certainly I've been an advocate of that and have enjoyed many conversations with Mike Callaghy, the county manager in San Mateo County, who I think San Mateo was really the first in the state to ramp up drive-through mass vaccinations. We currently have the event center that is been set up now, and Dr. Chabra. Now, of course, like everything we talk about here is supply dependent, and at some point before we wrap up, I'm sure we will talk about what just happened today. What now President Biden announced that will hopefully help there. But again, before we get to supply, any comment on the mass vaccination centers? How's that going, Dr. Chabra?
Sure. So as I mentioned, close to 10,000, 9,550 in a 7-day period at the event center. And these were healthcare workers, so it was the phase 1A group. And it really was to kind of show a proof of concept. So it was a drive-through event, up to 20 lanes of drive-through vaccination at the event center, with an observation area in a parking lot outside the event center with, all the appropriate EMTs out there just in case something went wrong, which it didn't, which is great. So we are really encouraging other healthcare systems in the county to take advantage of that, and some of them are. So, we've been talking to our, Sutter partners, Kaiser partners, Dignity, et cetera, HMC, and encouraging them to do similar things or find their own way to do, a vaccination event. Some are more interested in a walkthrough model, others like the drive-through model. And so I think we're just really working with our partners, supporting them in different ways to carry this out. It will not be necessarily the county sort of always running the whole thing, but doing it in partnership with other entities and, supporting them in being able to do something similar.
Right, because as we discussed, and again, it's important for people to understand this, the county only gets a small amount of vaccine itself, correct, right? A lot of the vaccine is going, as you said, directly to CVS or Walgreens for the nursing homes and primary care facilities, or it's going directly to the health plans themselves.
Correct.
And that's really, I think, been one of the issues. And I've personally been advocating with the governor, and he's been responsive to give the counties more authority or more ability to coordinate, because I think the counties have the resources to do these kind of mass vaccination sorts of setups. And I do have some good news. So we checked in, and again, I just want people, again, since we probably won't get through all questions, this is hopefully first in a series, and you can continue to turn to our office for more information. But again, a lot of it does flow through the multi-county health plans. And I reached out to many of the leaders of those plans, and I do have some updates that now would probably be a good time to share. And one was from Sutter Health. Many of you know Health and Medical Foundation is part of Sutter Health. You can call or book appointments online. But I can say that they will be opening a large vaccine clinic at the San Mateo Event Center by the end of the month. So I checked with them. They told me that they will be taking advantage of that mass vaccination site at the event center. So that's good news. I'll mention the others in a moment, but I think this is a good chance to hopefully clear up some of the confusion, although I'll admit that this is an area where the state hasn't made this easy to understand. But for both of you, what is your understanding right now of the tiers versus age, right? So first we started out with a very detailed tiered structure, and that looked at, of course, we talked about healthcare workers first, but then we had this 1B group with some other frontline workers. I advocated for teachers to be part of that group. As you may have read, I also wrote a letter with Buffy Wicks, and we got over 20 of our colleagues to sign it, to advocate for childcare and early learning workers to be included in that group. But there's 1A, 1B, 1C, sort of general. And then it was announced that we're moving to more of an age-based system, and that people over 65 could get vaccinated. I think that created some, I think that was a move for efficiency, which ultimately I think can pay off. And those are the people who statistically need it really the most, over 65. But there's not enough vaccine right away to get to over 65. So a number of health centers have said, no, we're going to start with 75. Let's make sure we do that first, because that is by far the highest, the highest mortality rate. And then we will move then to 65. So what is your understanding? Well, just first, for Dr. Adams, so El Camino, did you go right to 65? Did you go to 70, or did you start at 75? Where are you right now?
We're at 75. And by the way, I think if we do move to age, which I think would be fine, then it might make sense at some point to also do more regional vaccination instead of by patient. This allocation to health systems for their patients. Oftentimes I have perhaps a Kaiser patient across the street from me, from my facility, and they have to travel a long distance to get the Kaiser when they could just come to us to get their vaccine. And so I'm hoping that as the supply gets better, we can sort of liberalize how we're doing that, so we could be more convenient for people and also allow us to reach out to people, because there are people that aren't patients of those health systems necessarily. They don't have insurance. I mean, there's a lot of people that really need to be vaccinated that aren't accessible by those means. So I do think that's important. And so, but we've done healthcare center workers. We're doing the 75. As soon as we get a supply, I agree with you. I think teachers are essential. We need to get kids back to school. Not only is it better for them, it's driving all the parents crazy. And so, yeah, we've got to do that.
Yeah. I mentioned my own kids. Yeah. Both in high school, both doing distance learning. This is where my daughter usually works in this spot here, so I can't work here.
Yeah, right.
But I had to kick her out. Yeah, agreed. With you there. But again, you went, even though you had the authority then to go to 65, you went to 75. Let's make sure we take care of those people, and then you will then
keep going. Yeah, we'll keep going down. Yes, for sure.
Well, I know Dr. Morrow from San Mateo County would agree with you. I was speaking with him earlier, and he wrote in one of his very detailed write-ups, which I think people appreciate. I certainly do. That advice is to move to an any door is the right door strategy, and be more agnostic to the existing relationships. But again, we're not there yet. The current guidance is to go with your health plan. So if you're a Kaiser, you need to get it from Kaiser. If you're, Palad's Medical Foundation, you get it from Palad's Medical Foundation. And again, then in that model, the county is really only responsible for that fraction of people that you mentioned, Dr. Chabra, but the counties then can coordinate. And again, I've been advocating for that, and we've seen both San Mateo and Santa Clara counties doing that. In fact, Santa Clara County has basically mandated now that health plans, health systems share their plans and their data with the county. And again, I think to me, that is all very positive. It's just going to make it easier if the county knows what the plans are doing, where they are. Again, I think that's positive. I also think it's positive if the plans take advantage of the county's mass vaccination sites, rather than each plan having to set up its own vaccination high throughput, kind of situation. So again, I think that's where we're sort of getting to. It took us a little while to kind of get to this point, but I think that's where we are getting to. Dr. Chabra, what is your current understanding of tiers versus age?
Yeah, so I think all these discussions have made it kind of challenging to know what the current plan is. So there hasn't been an official change, as you know. We still have the governor's statement about focusing on 65 and over, with a particular focus on 75 and over, or those in disadvantaged communities, or those in an essential occupation, after the healthcare workers and the long-term care residents. That said, We think there'll be additional information about that coming soon, but the announcement we thought might come today hasn't yet. And so I know there are likely additional discussions happening around groups such as teachers, childcare workers, agricultural workers, and whether they fit with the age-based grouping or they're, in a different phase, a later phase. And so our focus really has been primarily to think about healthcare workers and long-term care residents, and then mostly 75 plus. We're really just starting in that area. Obviously, some of the multi-county entities have been doing that for a little longer than us, but just based on supply, our total vaccine supply as of this week was, 25,800 doses. So it wasn't huge.
Right.
We got an additional, 2,925 today. These are first doses. We'll have a big allotment next week, fortunately. But, with that, we've distributed that. The vast majority of it, 84% of it out. By tomorrow, probably 95% of what we've received will be out the door, either administered by us or provided to some other healthcare provider to administer.
Yeah.
So try to move it out as quickly as possible.
Yeah. You said by tomorrow, 95% will be out the door that the county has received. Yeah. And in case there's any, doubt about those ages, I mean, looking at the stats, 80 plus, 80 age is only 4% of the population and is 41.5% of the deaths from COVID.
High risk.
Very high risk.
Yeah, and 75 to 79 is 2.7% of the population and almost 12% of the deaths in California. So if there's any doubt about that, why we need to focus on that population.
But at least for us, we've seen the huge percentage of the deaths in San Mateo County have been in residential facilities, so congregate facilities for the elderly. So that's where something like half of the deaths have happened. And so, really supporting that CVS Walgreens partnership in any way we can. We've even gone out to some of the facilities ourselves and said, okay, this process is taking a little too long. We're going to start doing a few that are particularly high risk. So
good. Well, thank you. Thank you for your work. Yeah, doing that. I mean, it's been one of the tragedies of the tragedy that is COVID is what's happened at some of these, again, less so here, but at some of the nursing facilities across the country. Well, and thanks for giving me your current understanding of the tiers versus age based, and I've heard there will be some other announcements forthcoming, but hopefully it works to clarify. I will say I've heard a lot of good stories personally from people that I've been in who've reached out personally who say, hey, I'm concerned, my 80-year-old mother, my 80-year-old father, and then just more recently people saying, hey, okay, I want to let you know I was able to get an appointment at Kaiser. I was able to get an appointment at PAMF at El Camino. So it's been really good to hear those. Again, we will go longer here. It's scheduled to end at 6, but if you want to stick around, we'll go at least till 6:15, to make sure we get to more of these questions. There were some questions, people concerned about second doses. Are they guaranteed to get the second dose if they get the first dose? Because they've read about how in order to increase throughput of vaccines, we're taking some of the second doses and giving them now in anticipation of future second doses. Any reassurance you can give to people about second doses being available and the right second dose that they get?
Right. At least for us in San Mateo County, with the supply that we receive directly, we have made an intentional effort to always maintain the second dose. So we keep a second dose on hand and then distribute it at the appropriate time. And so we're not using first doses as sorry, we're not using second doses as first doses. We are keeping them separate in order to ensure that anyone who gets vaccinated with one product has the same product as a second dose, Moderna with Moderna, Pfizer with Pfizer. So we're really making sure that that's in place.
Mm-hmm. Mm-hmm.
Yeah, in Santa Clara County, yeah, we've also been very deliberate that there's first doses and there's second doses. They're different batches, different allotments, and generally everybody that we give a first dose, you know, at the right time, 3 weeks, we get a batch for the second dose. That's really totally separate. And I will say from a scientific point of view, since I guess we know we're getting back to science again, with the perhaps in the, you know, this year, that it really would be foolish to just give out first doses because it's not as effective as having the second dose. So having a whole bunch of people partially immunized isn't really going to help us. You know, we've got to really make sure we're fully immunizing the people that we do. So yeah, we really have to keep doing we're doing a bunch of second doses right now for the healthcare workers, first round. And so our first doses in for the community is totally separate, different site, different system, different scheduling. Yeah, totally different.
Yeah, got it. I did mention, as I, also reach out to Kaiser. So I think it's probably a good time to say they let me know they've received only enough vaccine for about 2.5% of their 12.4 million members. And that's also been held up when I've talked to other county officials. They've shown me the numbers, and Kaiser seems to have not gotten a significant share for some reason. They've said we've been following the state's vaccine prioritization, and while doing that, they're focusing on healthcare workers, supplies have allowed, they're expanding to 75 and older. They apologize for the frustration of some of the members encountered with the availability of appointments. The appointments are limited because the vaccine's limited. And even when reaching out to members 75 years or older, they're prioritizing patients who are at increased risk of mortality or other severe disease because of comorbidity conditions. They mentioned that the expansion of eligibility by the state to include those over 65 resulted in the phone and appointment systems being overloaded with requests to reach and schedule populations. And they also mentioned what you said, the unevenness of the vaccine supply. And I think there was sort of this big thing at the federal level where they said, okay, we have this big reserve, we're going to release the reserve. And then turned out there was no reserve. So again, a lot of that has flowed from, unfortunately, I don't think a lack of consistency at the federal level has permeated down. So I did want to share that. I can share some notes from Dignity Health as well, where they started vaccinating their frontline staff and physicians in mid-December. They are about supplies being limited, but they're well into their second doses for the Tier 1A folks and are evaluating expanding vaccination to affiliated patients over the age of 65. So they are looking at that and working on their expansion strategy. But they, again, we also have the supply issue that they're dealing with. Did either of you watch Biden's statement today? I have some bullets written up, but did either of you watch it? Any comments on what they're planning now at the federal level?
I didn't get to see it yet.
I'll just mention, Mark, or I'll just mention a few highlights that we pulled out. So he said he wants to get, there was 10 executive orders to ramp up vaccinations, expand testing, reopening schools. 100 million shots in 100 days is what he announced, increasing the number of vaccination sites, creating federal community vaccination centers in stadiums, gymnasiums, involving the National Guard, which is one thing that I've called for here at the state level. That gets to the question of who can administer it, make sure we have enough people which also involves getting some of these additional volunteers into the system, which is again currently done at a county level, and we will send that information. $20 billion to establish a national vaccination program, expanding federal Medicare assistance percentage to 100% for the vaccine, $50 billion to expand testing, fund 100,000 public health workers to work in the local communities, and $130 billion to support schools in safely reopening, ensure schools can reopen safely. And I'm going to call out our own local Congressman Ro Khanna, who I worked with Senator Sanders on the Medical Supply Procurements Act to enlist the Defense Department in defense procurement process in PPE and vaccine, and that seemed to be part of this announcement too. So once I digest that more, we'll get out more information, but those are some of the highlights that kind of gleaned from what I heard today. You guys, are any shortage of PPE locally, or has that at least that problem been solved locally? Have you heard? I haven't heard anything in our district. I heard from the Nurses Association some concerns with a couple of hospitals, other in San Jose. But any concerns about PPE?
I think the main challenge in recent months has been with N95 respirators, and so fortunately there's some new products by different vendors than previously, and these are fully approved N95s. But sometimes there are issues with sizing and fit and that kind of thing. But overall, it's so much better than it was a number of months back. Yeah.
Well, on the bright side of vaccines and production, I was very moved, as I'm sure many of you were, by Amanda Gorman, the poet from the inauguration, who's a California resident. Yeah. And one of her lines, she said, "But there's always light if we're only brave enough to see it." It was a very inspirational line. And Congressman Jackie Speer and Congressman Eshoo have been regularly updating all the local officials as well. And Congressman Speer recently, this week, said that she believed the J&J vaccine could be approved within a couple weeks. And there were a lot of doses of that procured, and that Moderna and Pfizer were really stepping up and doubling production, although again, we probably won't see the benefit of that ramp up till later in the spring or early summer. Any news, anything you can tell us about the J&J vaccine?
Well, I think we're all eagerly awaiting the results of the phase 3 trials and what they actually submit to the FDA, hopefully very soon. I think just having a one-dose vaccine will be incredibly helpful and really speed up the vaccination process tremendously.
Absolutely, absolutely. Dr. Adams, any insight you've heard or any other information?
I have not heard, but I agree with Dr. Schaber. We're all just waiting to see the results. So if we can move ahead, that would really be great to have more suppliers.
Great. Well, I mentioned we were going to continue on over our deadline here. Really appreciate both of you staying with us here. Of course, we got a lot of questions on reopening. When can we reopen? And a lot of that is done at the county level. Sacramento area, I know because I was up there twice this week, has now moved back down into the purple tier, and they have reopened. And that's really based not always on exactly where you are, they're projecting where you're going to be. And they projected that for Sacramento, and that's why Sacramento has reopened at that tier. Any thoughts from either of you? I mean, it seems like we're sort of trending in that in that positive direction. Any thoughts on reopening that you can share with us?
I think the general sense is that we may have peaked from the post-holiday, Christmas, Hanukkah, New Year's celebrations. gatherings, even though ideally people weren't doing that, but I think there was a certain amount of that happening. And so I think we're moving in the right direction, but right now, certainly in San Mateo, our ICUs are still very full. Our hospital beds are quite full with COVID patients. So maybe we've peaked, but we haven't dropped, to a great level yet. Obviously, everyone wants the ICUs empty. I would too, but we're still pretty full right now.
And schools, anything?
Yeah, we have to look at the metrics. We really have to follow the metrics. I think the guidelines are good. Looking at the trends, the positivity rate, the ICU capacities. I mean, I think we're monitoring the right metrics closely, and I just think so. In Santa Clara County, for example, last week we were running about 700 COVID patients in the hospital at any one time, and now it's down to 600. And so we are seeing a gradual decrease. And like Dr. Shaver said, if a lot of this is post-holiday effect, that should start to go away. But we do have a ways to go to sort of get it lower. And the last thing we want to do is have another rebound.
Right.
And so while everyone's anxious to get back, everyone is, we do want to be very careful, that we don't have another rebound. I don't think anybody wants to tolerate that again.
I mean, the data does show that schools can reopen, especially at the younger ages. We've sort of seen that in some other states. We've seen, from the county, I've gotten estimates. I don't, not exactly, but it sounds like 15-20% of schools maybe are open. Many of those now are, of course, are private schools. Anything? Neither of you guys are more on the medical side and not responsible for those decisions, of course. But any other thoughts on how we can get schools reopen quickly? Obviously, vaccinating teachers is top of that list.
Right. I mean, I really see that as being the major factor right now, as you mentioned. I think a lot of schools want to open. Obviously, a lot of parents would like the schools to open. And I think a lot of teachers and administrators would like to open it. But you do need the teachers to be vaccinated before that happens, because they're the ones who are going to be most at risk. Maybe some of the high school students could be at risk too, but the elementary school children, even when they get COVID, they tend not to get very ill, but the adults could.
Yeah. As I mentioned, I would not mind not that I want my kids out of the house, but had my son see the inside of a classroom in his freshman year of high school would be nice if we can do it. I know they're working on ventilation and other things and looking at the rooms, and but I hope we can take advantage of there's new technologies that I've seen around being able to disinfect. Some of the hospital technologies that have now sort of become cheaper and more accessible at a possibly school level. So I hope we do look at those and consider those as well. So just looking through the rest of the questions. Well, I'll just ask you both, and then maybe we'll do another 5 minutes and wrap up. Are there things we're missing, things that I should be asking you today, things that we're missing in our conversation?
I think I just want to highlight what Dr. Adams said earlier, which is despite the growing availability of vaccine, and it's not as fast as people want, but it will get better over time. It is just so important to still continue all those public health measures of social distancing, masking, avoiding large gatherings and such. One, because you have people who aren't vaccinated or don't have immunity from having had the disease. Two, while the vaccines are extremely effective, they no vaccine is 100% effective. And so we can't let our guard down. So I guess that I do want to reiterate that, because it is I think people may sometimes feel, okay, I'm vaccinated now, or I've had my first dose of vaccine, I can kind of go back to normal, and please don't, for your sake, from your family's sake, and for the community's sake.
Yeah. Well, thank you. I do think that both the public health systems in both counties have really have risen to the occasion. I believe, San Mateo County is a large health system. I was talking to Renee Santiago from Santa Clara earlier. That's, the second largest public health system in the state, 12,000 employees, almost $4 billion in revenue. I'm going to try to go to the fairgrounds this weekend and to check that out, but they've got about 2,000 people a day now at the fairgrounds, again, opening up in Mountain View location on Friday, and then hope to start ramping up the number of pages there. Pointed out to me, or he advocated, he said, it shows that, lessons globally really is that health systems that are universal and have a robust public infrastructure have fared better in this pandemic. A lot of people to me point to, say, Israel, for example, and Israel does have is a universal health system, has strong public infrastructure and strong data systems, and has done very well. One issue, people are concerned, again, when I talk to people at on the medical side, say at Stanford Healthcare and such, I hear that a lot of their patients that are seeing are from communities with a lot of frontline workers, communities like East Palo Alto and East Menlo Park. How can we get the vaccine to those locations and to the people there? I know, Dr. Chhabra, maybe you could address that.
Sure, and it's a great question. So we see some of our primary routes for that as being the community health centers. So certainly if those communities, when they have a community health center, like East Palo Alto, East Menlo Park has Ravenswood Family Health Center as one of those federally qualified health centers, then working very closely with them, which we are, to ensure their reach in the community. They're a trusted partner. People are very happy to go and get vaccinated there. We're also looking at mobile options. So vendors who could potentially go out to a community event or set up in a community site for folks who are less comfortable going to a clinic setting or to the event center or someplace like that. And then there is a lot of potential with pharmacies. So most communities have pharmacies, and we have ones that already want to work with us, and we could allocate vaccine to them to vaccinate, a certain population in that community. And I know the federal government is also looking at working directly with pharmacies, not around the long-term care issue anymore, but specifically just around vaccinating the general population, maybe by age group, through community pharmacies. So I think that's another great option to get really widespread and get equitable distribution of vaccine.
Good. Well, as you know, you can certainly count on our office. Anything we can do to help there. Just in general, we're on this 24/7. That's why you've seen a lot of posting from me on this. You've seen a lot of calls and emails, and I think I don't know if it's the right analogy. I think Biden used the term wartime footing, and that's kind of where we've been approaching it as well. I mean, this is the hope for people in what's been just a devastating year, and to quote Amanda Gorman again, I think she said, "For while we have our eyes on the future, history has its eyes on us," and we'll look at how we fared here in the next couple of months, really, to get our society back up and running and our people working again. And I just thank you both so much for your time, for answering all our questions. I want to thank everyone who tuned in, and literally we had hundreds of people, almost 1,000 people sign up. We had hundreds of questions submitted. So if you feel like your question was not answered, by the way, a lot of the questions were on specific professions, which gets to that tiered system. And I think we're all now waiting to hear. I've asked the state a number of times we're waiting for them to, get clarification about the tiered system now, where it fares versus the age-based. But hopefully we've been helpful in clarifying some of this for all of you. The both county websites, which again we will also send out, have links to not only what they're doing, but also what the different providers, how to link to Kaiser, how to link to PAMF, how to link to El Camino. And again, I've just been gratified as I start getting incoming now. People say, yes, my parents, my mom, my dad, my mom, were able to get signed up, and that's reassuring that it's starting. But I think everyone's looking now to us to say, great, California, let's do this right, let's do this quickly, let's do this efficiently, and let's get this vaccination out there and this virus under control. So with that, I will wrap it up. Much thanks to both of you. If we were in person in the old days, we'd all have a round of applause. So applause to both of you. I really appreciate you being here and staying overtime with me to answer some of these many questions. And I look forward to staying in touch.
Well, I'd like to thank you for stepping up right off the bat, getting into the Senate, but this is so important, and thank you for, jumping out in front of it and doing this. The more we can, reach people in any manner or fashion is great. So kudos to you for, stepping up and doing this.
Indeed, thank you. Thank you very much, Senator.
Sorry for you.
All right, thank you all.
Okay.